Hi, friends, and welcome to the Dr. Green Mom Unfiltered podcast. This is your host, Dr. Ashley Mayer. I feel so honored to have this opportunity to support you and your family on your parenthood journey. Just a note before we begin, if you enjoy this podcast and would like to support my work, please consider subscribing at drgreenmomvip.com. Subscribers have access to my full-length episodes, my very lengthy library of parent-focused resources, including my treatment protocols, access to my parent support group, and exclusive product discounts. As always, I appreciate your support. And now let's begin. Hello, friends, and welcome to my podcast, the Dr. Green Mom Unfiltered podcast. We have not recorded in a couple weeks, and you know what? I like to take my holidays off. I like to really just spend them with family and friends and, not be thinking about this next topic or any topic in general. And so welcome back. I've got Dr. Lydia here. She is such a fantastic addition here to Dr. Green Mom, and it's such a pleasure to have her here working for the company. We've got a lot to cover today because there was a huge announcement, Dr. Lydia, the other day. The Department of Health and Human Services and the CDC came out with new vaccine schedules.
They did. Really important that we speak to this and get some clarity for our lovely parents.
Dr. Lydia and I have been talking about this for the past couple of days. She's actually the one that's pinged me in Slack and said, oh my gosh, take a look at this. Look at the press release that just came out. And I was shocked, y'all. Honest to goodness, my first thought was 15 years of my blood, sweat, and tears just culminated into this press release. The vaccine strategy that I have been teaching all parents for so long has now happened. We have 3 different schedules now, and we're going to get into all of it. The first schedule is just universal recommendations for all kids. And then there's a second schedule for those in high-risk populations. And we'll discuss that because what does that even mean? And it's quite interesting, especially with regards to RSV. And the third is what you're going to talk to your doctor about. This is between you and your doctor, and you guys are going to come to an informed decision and decide if any of the vaccines on that clinical schedule are going to be right for you. And this is what I've been doing, Dr. Lydia, for so many years. It's so cool. But you know what, guys? It's getting really confusing. And so we wanted to talk about this today.
Yeah, I just, you've been one of the lone voices that has really been vaccine neutral and just maintaining the fact that parents should have conversations. Pediatricians hopefully are open to discussing these things, the risks and the benefits, and just having parents feel really empowered. And I think that's hopefully what is going to come about with these new recommendations is that there's a renewed trust in public health. I think a lot of parents kind of post-COVID, the communication just wasn't there, and public health, the faith in public health system just went downhill. And you absolutely can't have that. You need to be able to trust public health initiatives as much as you can and be able to have conversations with your doctor. That's just a must. It needs to be like that.
In a nutshell, it's honest to goodness, the loss of faith in our healthcare system, it stems from the very beginning of it, or the very tail end of it, actually, is having a discussion with your doctor. Vaccines pose risk, but disease also pose risk. Mm-hmm. So it's looking at both of those and coming up with an informed, educated program that's going to be best for your child. And sometimes that means all of the vaccines that are on the CDC schedule. Sometimes that means delayed schedule or less doses of certain vaccines. And sometimes that just simply means not vaccinating at all. And so having that conversation with your doctor has been so important. But why I came out with the Medical Freedom Healthcare Provider List, actually, I didn't come out with it. Dr. Bob Sears did initially. I've just added to it over the years. So I would just like to plug him because he's so special. I just love him dearly for what he's done. But there's over 5,000 healthcare providers on that list that will take your child if you choose to delay a schedule or not to vaccinate at all. And that's becoming increasingly more difficult here in the United States, is to find a pediatrician who will do that. And so I am going to be interested in this, Dr. Lydia. How are these healthcare providers going to be able to sit down and have these discussions with patients? So I'm looking forward to seeing how this unfolds.
Me too. So shall we dive into, it was interesting for me to think about who are the major players in vaccine decision making. And I want to kind of clear some of this up for myself, also because I'm a Canadian and I'm learning about the American healthcare system. But I also suspect that there are American people who get confused by this as well, because there's a lot of different stakeholders involved. Is it okay if we dive into that?
Every one of them have a different opinion right now. This is what is going to be so confusing for parents. And it's confusing for me, y'all. If I am confused on how all of this is going to unfold, I can't even imagine what it's like for you as a parent to have to figure this out. And so I think we'll chat real quick about what is the stance of each of these major players and how this is going to take place, or how are their lack of uniformity in decision, how is this going to play out for you as a parent when you are trying to make these vaccine decisions?
Yes, and that's really why we're going to talk about the players, is so that parents can temper their expectations and know when they're speaking to their doctor, who is their doctor responsible to? Because their doctor isn't responsible to the CDC. The doctor doesn't necessarily have to follow CDC recommendations. And I think it's important for parents to know that. And I also want to speak to our lovely parents in mandated states, because they're the ones that often feel like they have the least amount of choice, because they do, and their hands are tied. So do you want to dive into that?
Well, I came out with a video and put it on social media the other day, and I was praising this press release that came out, and I'm very excited about it. I'm very nervous about it as well. And the sad reality, there were a ton of comments from parents saying, oh my gosh, does this mean I live in California that I will no longer have to vaccinate my kiddo for XYZ because it moved down to the special population schedule?
Right.
That's simply not true. If you live in a mandated state, you have to abide by that state, the state laws. So just because there's been a federal change, the states govern themselves. And so California and New York, Maine and Connecticut, you all will still have to abide by the laws in your state. And so that's one just tiny little piece that is super confusing, is that, hey, the CDC changed their schedule. So does that mean that the schedule is completely changed? And for my state, no, it's not. So this is just a first step in making some of these changes to the laws in your state. So this is going to be the confusing part, or one of the confusing parts. Is I was telling Dr. Lydia, pediatricians will say, hey, if you don't fully vaccinate by age 2, or if you don't completely follow the CDC schedule, you will no longer be able to participate in my medical practice. You'll have to find another doctor. So I'll be very interested to see what pediatricians start saying now. Because if you're in California and the pediatrician says you cannot be in my medical practice if you're not fully vaccinated, according to the American Academy of Pediatrics now, according to the state of California, because according to the CDC recommendations have changed, and the CDC recommendations no longer align with the recommendations or the mandates in a mandated state like California. So it's going to be confusing as to what pediatrician stances happen to be regarding these new rollouts. Because again, the American Academy of Pediatrics has taken a stance that we do not agree with the CDC or the HHS. And so we're going to continue with our the old vaccine recommendations.
That's right. The American Academy of Pediatrics, the American Academy of Family Physicians, and the American Medical Association have all expressed quite deep concern about the CDC changes. They are not changing their stance. And your pediatricians, family doctors, they are not accountable to the CDC. They are accountable to their state medical board, their licensing board. And the licensing board takes advice mostly from these physician groups.
Correct.
Yeah.
So if you are in the state of California or Connecticut or Maine, and you have a conversation with your doctor, hey, I want to align with what the CDC says, I don't know what these conversations are going to look like. I am just as confused as you are. So what I'd like to say about these new guidelines is that this is a first step in communication. This is a first step in just opening up this whole ball of wax and really start pushing against these mandates. I mean, truthfully, you are a vote in your state. So when it comes voting time, these are the topics that need to be addressed, is the confusion between who do we believe, who do we trust, and how do we go about this?
Yeah, and I think it's important to remember that mandates are laws, so therefore they're made by the state senators as a grouping, so who are not physicians or doctors, but will take consultation from different interest groups. But if you're looking for change, really what you're doing is you're lobbying your state senate. Like, you can chat with your doctor as much as you want to till you're blue in the face, but the doctors also do not have the authority to be changing these state mandates if you're living in Maine, Connecticut, New York, California. Is there another one? West Virginia is kind of on the borderline there, but.
Yeah, I think the governor of West Virginia, was that the governor of West Virginia? He said that although it is a mandate, he wrote an executive order that you have freedom of choice in West Virginia, at least right now while he's governor.
Correct.
All right. So a lot of, even my family. So I get kind of shunned by some of my family members because they don't align so much with what I have to say, only because RFK Jr. is heading this up. And so I like to think that I'm quite neutral when it comes to politics. Whoever's in office, it has no bearing on my decisions with vaccines and how I teach vaccine strategy. And so I don't care who was in office that decided to bring this about. So the fact that, people are not aligning with the CDC recommendations now because they don't necessarily like the politicians involved. It's hard for me because I think this is such a huge win for medical freedom. This is such a huge win for individualized medicine. I'm just blown away with excitement because this is something I truly believe in. But the fact that it's getting poo-pooed because of the politician or the politicians who have their hands in it, it's a real bummer. It's a real bummer for me. And it's, even my family. And so I just want y'all to know that it doesn't really matter who the politicians are that are bringing information to light. If you align strongly with the idea of individualized healthcare, this should be a win for you, even if you are on the other side of the political views who are currently bringing this to light. How's that? I don't want to say Republican or Democrat, blah, blah, blah. But this is a universal win for everybody. I don't care who brought it up.
Absolutely. Yeah. And this is also why we encourage parents to be sort of mindful about the conversations they engage in, because sometimes you can get really trapped in the weeds with these conversations and you're going down a road that you don't even want to go down. You're just trying to make a decision for your little baby, and sometimes just keep it close to the chest and do what's right for you, and don't even go there with people who are committed to misunderstanding you.
The CDC and the HHS have highly, highly regarded physicians and who are reviewing these studies, who are looking at the research. So it is scientific. We are advancing. We are advancing science here, people. I think this is a huge win. The idea that we are going to now look into clinical trials that have an inert placebo with regards to vaccines, I think that's fantastic. We're moving forward in a really, really brilliant direction. So off the soapbox about politics, the reality is this. I don't care who brought this up. I don't care what politician did it. I am super excited.
Yeah. And I'm excited for you because, again, you've had this message for a long time. So this is like a lot of your life's work coming to fruition, which is nice to see.
Yeah, I don't know. Am I done? Like, all right.
Yeah.
No, honestly, we've just cracked open and opened up a huge ball of wax, guys. Like, I think there's going to be a lot of discussion and a lot of legislation popping up here real soon. And I really do think that there's going to be some really great stuff happening. There's also going to be some really negative stuff happening and a lot of pushback from these medical organizations. And so I think at the end of the day, who's going to lose out most is the parent. So you parents are just going to be most confused and most upset because you don't know what to do. And I'll say this now, and I don't know, Lydia, if this was in the show notes for later, but one of my biggest concerns for parents is that I have always taught inside my vaccine strategy guide, and I've always taught on any videos I've done, is that if you choose to change the vaccine schedule, if you choose to delay or forego vaccines, I've always said assess your risk. Assess the current risk of whatever disease within your population and decide whether or not that vaccine is important right now. It may be important later, but is it important right now? My child's 2 months or 4 months. I would prefer not to vaccinate so early. What are the chances my child will come down with pertussis? In my area, I live in Arizona, and I will tell that parent, assess the risk. Check what the case count looks like in your area. Well, guess what? We don't have, the CDC is not currently putting out really great data, weekly data on current case count in your area. And so this is another layer that I just feel for parents, because it's like, okay, now we have 3 different vaccine schedules. One of those schedules is to speak to your doctor about which vaccines are relevant right now. Well, if there's no data on risk, if there's no data on how many cases are in your area currently, and you don't plan to travel, if that's the case, hey, I'm here in Cave Creek, Arizona. I have a 2-month-old. I'm not traveling anywhere anytime soon. I don't have a kid in daycare. I'm not putting them in daycare. It's just me and kiddo and my partner. Can I delay these vaccines? I would say, reach out to your local health department or go on the CDC and take a look at the current risks, the current case count in your area for that week and for the following weeks. And we don't have that anymore. So I don't know what the conversation is going to look like with parents sitting down with their doctor saying, do I or do I not get this meningococcal vaccine? Or do I or do I not get this hepatitis A vaccine or hepatitis B? Anyway, it was just kind of a thought that I had. Again, my heart goes out to parents.
Yeah, I can see a lot of those conversations are probably going to go to worst case scenario. Your kid's if your kid gets meningitis or sepsis or something like that, which is obviously going to be very scary and concerning for parents, without tempering it with what is the likelihood that my child would even encounter this bacterium or virus, etc. Because even if you're a pediatrician and you want to stay informed and you want to be on top of these numbers so that you can have these conversations in an informed way, I'm not sure how they are supposed to. Are they supposed to be contacting their local public health department every single week to know what's going on? Because, with the average pediatrician schedule, that's probably not going to happen.
What I'd love to see? I'd love to see local health departments having to put out this data. I think that would be fantastic. If that could be realistic, I think that would be just so fantastic. And I don't think it would take a whole lot, Dr. Lydia. Do you? Where, once a week or once a month, there is an update on your local health department's website that says, here's the case counts this week for XYZ. Because you're right. What a pediatrician is going to do is say, hey, this is what could happen if your child does contract meningococcal. Yeah. They couldn't say what the current risk is, which is what I've always enjoyed with the CDC is they were so gracious about putting out that information until January of 2025. So it's been a full year of very little information for me to go by. Dr. Lydia has been fantastic. She has been calling local health departments. She has called the CDC, and she gets great information when she does make those phone calls. But she's right in saying, I'll let you speak to this, that all health departments are very different.
They are. And it depends if you're living in a major urban center. If you live in Boston, it's going to be different than if you live in a small town in Alaska in terms of what sort of reporting structures they are. But I will say that everybody that I've spoken to from the public health department is very lovely and very nice. And I think many of them are parents. So when I bring this up, as like the average mama wants to know, they get it. And you can talk to a human being when you call the public health department. So I've only ever had positive experiences, I will say. And if they don't know, they always follow up with me. So I would encourage parents to try to make a connection there. I haven't had a bad experience thus far, both with big and small public health departments.
Yeah, so I wanted to throw that out there. Get involved with your local health department. I think that will be the best way. If you would like to delay or forego vaccines, specific ones, et cetera, get involved with your local health department if you do want to assess current risk. So
yeah, they're going to be like, oh, we have another one of those Dr. Green mamas calling. Wants to know about pertussis. Yeah.
Which I don't mind at all. I think that'd be so great.
That's cool. We love that for you guys.
I wanted to get back to some of these governing bodies real quick. Dr. Lydia put in the show notes, and I just want to say, I want to tell you what some of them are saying. So the American Academy of Pediatrics, with this press release, they have a stance that says removing vaccines is dangerous and unnecessary. That's their rebuttal or retaliation when the press release was put out. And the American Academy of Family Practices, they stand our ground on vaccines, highlighting their safety and effectiveness. The American Medical Association is deeply concerned by recent changes to the childhood immunization schedule. I guess I would just assume that these governing bodies would have a relationship with the CDC, a relationship with the HHS. They must not. They must not talk. There must be zero crosstalk, which is very concerning to me, right?
Mm-hmm. Yeah, I was kind of surprised at actually how little power the CDC has to enact change. It's not really their role. They monitor and survey the American public to make sure that there's no major health crises, kind of something's going downhill in Iowa and we're not paying attention. But they are more about surveillance and recommendations, but they don't have a lot of power necessarily to influence individual physician decision-making unless that physician chooses to listen to the CDC.
Yeah, and so ACIP, which is the Advisory Committee on Immunization Practices, have you seen, did they come out with a stance on anything?
Well, they are the ones that influence what the CDC is doing. So they would be aligned with the CDC. What the CDC has put forth would be that information would be coming from this advisory committee, which should be an independent group of experts, epidemiologists, immunologists, pediatricians, and they are supposed to be neutral. In the past, that had been called into question. Did these people, formerly work for a vaccine company, or could they work for a vaccine company in the future? So there can be some issue there. But
yeah, one of them has a patent on the rotavirus vaccine.
Right. That, for example.
One of the board members of ACIP. And so, again, not to throw politics back into it, but we have to with this. Recently, most of the members of ACIP were let go. And there's now a new advisory panel. And so I think a lot of that probably plays into the distrust of these medical governing bodies, like the American Academy of Pediatrics and the AMA. And so they're like, hey, look, all these politicians did was get rid of our advisory committee, bring in their own people to be our puppets. And so that's another way to think about it. And so, I understand both views. I understand, I do. I completely understand that a lot of this was very quickly done. And, there were some key events that took place for all of this to come to light with the CDC here recently, and it was very political. And so I understand. What I don't understand is, again, why there's no crosstalk between these governing bodies who ultimately are the ones making the decisions for these doctors. So you abide by your governing body. So the American Academy of Pediatrics, if they put out all pediatricians must do this letter, all pediatricians must do this, or they may lose their medical license. And so I don't think that these CDC recommendations are going to change anything that pediatricians are doing right now. So it really is going to be up to you parents in all of the states where you can make your own decision, where you can have a religious exemption or a philosophical exemption. It's a lot of education on your part to make a decision in which vaccines are in the best interest of your child. So
yes. And I will say we have episode 3 where we go into vaccine decision making. So if you're in that process, we go through each of the vaccines. We talk about what it is, and we talk about the diseases so you can understand what the diseases are when you go into those conversations. And in our kindergarten episode, we talk about mandates, the religious and philosophical exemptions, because one good thing about those is you don't have to over-explain. Okay, you just say, for philosophical reasons, I'm not doing this. You don't have to justify or get into some big, long conversation. So if you're in one of those states, you can still do the paperwork and just keep it simple for yourself.
And same with religious. You don't have to state your religion. You don't have to give much information. Dr. Lydia so graciously came out with an entire religious and philosophical exemption document. Can we put that in the show notes?
Yeah, sure.
Let's put that in the show notes. Yeah. You can find it at drgreenmom.com under resources. And it's free.
Yes, we have a kindergarten exemption list because some states you have to notarize, some states have templates. It's very, again, state by state. Wouldn't this be nice if this was federally regulated? But it's not. So you will have to know your own state, and we can help you with that. Basically, we have a chart.
Yes. So I want you to know that my team is working very, very hard, all of us here at Dr. Green Mom, to update all of the information that we can with regards to vaccines, helping you to understand what your choices are. And I'd like to do this, Dr. Lydia. I would like to come out with a template of questions and how to open up discussion with your doctor. Because of these new recommendations that have come out, you parents, you have a voice. Like, you get to tell your doctor, I'm not doing hepatitis B right now. And here's the reasons why. And I'm so excited that you have this option of dialogue now. And I'll tell you what, one of the reasons why I'm so excited is because when my daughter was little and I was going through my divorce, and one of the reasons why I got so invested into vaccine strategy was because I went through a large court battle with my daughter in vaccinations. And I just remember the doctor just being so brutally rude to me. And I was just such a young doctor at the time. And she was just so mean and telling me my child's going to die if she doesn't get the pertussis vaccine. And it was just so brutal. And I just remember thinking, I cannot wait to help parents with this kind of dialogue so they don't feel so terrible when they leave the office. I left the office in tears. And no parent should feel that way when you leave. And so I'm just excited that we're entering into this era of opening up dialogue with our doctors and being able to say, hey, look, like, this is what the CDC states. Keep politics out of it. I know what you're saying, but help me. And I think over time, it's not going to happen right away. I'm excited to see what 2026 has to offer with vaccines.
Yeah, and we are going to help parents today with questions that you can be armed with when you go in to see your doctor. So we'll leave you with some real practical questions. And I don't want parents to also feel like they need to be vaccine experts when they go in. Like, it's okay to be like, I'm confused about this. I need clarity from you, and I have some questions. So we'll help you mold those questions as per vaccines. And then we also have just some general questions you can ask. So we can dive into this soon.
Okay, perfect. So to close just this little part, what are the reasons to be excited about this? Because there's reasons to not be very excited about this new press release and this new three types of schedules. And then here in a minute, we're going to start talking about what are those 3 types and what's included in those 3 schedules, etc.
Yes. So reasons to be excited is you get to have conversations. You can use critical thinking. And if you have some instinct about this, you can bring it to the table.
Yeah, which is what I said, I guess, in a nutshell. And we didn't really, I guess we don't really have to go over the reasons not to be excited. I think we went over those too.
Yeah, not that much has changed.
It's going to be difficult. Yeah, not much has changed. You've still got a lot of the medical system against you, like is kind of in a nutshell.
Yeah, mandates still there.
Mandates are still there. Okay, so let's talk about the 3 groupings of vaccines. I think Dr. Lydia, you're amazing. I was going to pull up the new schedules, but you put it right here.
Yeah, we do have it here. Immunizations for all children, there is very little change here.
Yeah, so, what got removed from the immunizations for all children is the flu vaccine, the COVID-19 vaccine, RSV, hepatitis A, hepatitis B, and meningococcal. So those are now no longer on the CDC schedule recommended to all kids. And 1 HPV of the 2 doses was also removed from the vaccines for all.
Oh, that's quite a significant change. Okay.
Yeah, there's quite a bit that got removed, but that doesn't mean that they're removed. And here's an example that I wanted to pull up to explain, because just because RSV moved off the immunizations for all kids doesn't necessarily mean that you don't get the RSV vaccine. So Dr. Lydia is going to put the link in the show notes with the 3 types of schedules. Now, what you're going to see underneath each schedule is a lot of written information, and it's going to have numbers by it. So as an example, the RSV vaccine is now recommended only for certain high-risk groups or populations. But as an aside, what it says is it's only recommended to children whose mothers did not have the vaccine in pregnancy. Babes should get 1 dose. So just because it got moved down to high-risk populations, what makes you high risk is if mom didn't get the RSV vaccine. Mm-hmm. So if mom didn't get it, then babe should get it. So it's not that you don't have to do it. It's that you really do need to look at those bulleted asides underneath each schedule, each of those 3 schedules. Okay. Mm-hmm. And another example, let's say that's 1 dose, but if child has chronic lung disease, say they're born, mom did not get the vaccine. Mm-hmm. If they're born with some type of lung disease, the CDC is recommending 2 doses of the RSV vaccine. Okay? Mm-hmm. So keep that in mind, that you definitely need to read those asides at the bottom underneath each of these schedules. Okay? Mm-hmm. And as a simple example, hepatitis A, it's not going to be recommended anymore for everybody. But if you decide to do international travel to areas with higher intermediate hepatitis A endemicity, get the vaccine for that. So you need to really take a look at each of those 3 schedules. So there's 3 of them. What I'll say, I'll just read quickly. The vaccines that you still need to get, quote unquote, according to the CDC, is the MMR, the DTaP, polio, varicella, Hib, pneumococcal, and HPV. Okay? And then high-risk groups, which could simply mean mom didn't get vaccinated in pregnancy, that would be RSV, hepatitis A, hepatitis B, and meningococcal. All of those used to be on the CDC recommended schedule for all. And what you have here, Lydia, can you speak to this about if you do choose to do these vaccines, it does not necessarily mean your child's not healthy.
Yeah. So, all of these decisions are quite emotional for parents. And I don't think parents appreciate having their child labeled as high risk necessarily, because sometimes it just means that you travel to Bolivia frequently and you may encounter hepatitis A. It doesn't mean that your child's not healthy.
Or according to the CDC, your child's now high risk because mom chose not to get the RSV vaccine in pregnancy.
Right.
Like, that's not great lingo for a mom or dad. It makes you feel like, oh no, was I supposed to do that? No. If you choose not to get vaccinated in pregnancy, that's on you and that's okay. I don't necessarily, I'll just say it, my personal opinion. I'm not sold on vaccines in pregnancy right now. So it doesn't mean that your child is not well now because they have to get a dose of RSV. And keep in mind, in all states, even mandated states, you do not have to do the RSV or the RSV vaccine in pregnancy or the RSV vaccine at birth. It's just here as an aside that the CDC recommends. They recommend an RSV dose to an infant if mom did not get the RSV vaccine in pregnancy. That doesn't mean it's mandated. It doesn't mean you have to do it. So just because these schedules have this information on it, take it with your informed consent, and then you decide whether you do or do not want to do this.
Yeah, I suspect parents with children who are born prematurely are going to receive a lot of pressure and pushback to do full vaccine schedules. And we know a lot of premature babies end up just fine. They grow just fine. So again, it doesn't mean that your child is not healthy if you end up in one of these high-risk groups.
Yeah, other high risk that we may speak of is a medical diagnosis, not necessarily something mom chose not to do or whether you travel. Dr. Lydia has listed here anything affecting the lungs, heart, liver, or immune system. That could be considered a reason to vaccinate these few vaccines that got pushed to the high-risk schedule. And that is cystic fibrosis. These are just a few. Congenital heart defect, immune deficiency, or metabolic liver disorder.
Mm-hmm. I think that some children might be labeled high risk based on environment, like their parents' work. Like, say you're an emergency room nurse and you are in constant contact with people. My partner, he works with underhoused people. A lot of them end up with different sorts of respiratory things. My daughter might be considered high risk because her parent works in such an industry where he's coming in contact with a lot of different individuals.
Correct. So that would make kiddo more high risk just because of what the parent might do for a living, or if they're smoking in the house, or if you have multi-families living in one home, that increases your risk. I like what Dr. Lydia put here. If your child has a history of continually getting very ill when they come into contact with illness, that could be a high risk reason why you would want to vaccinate according to this high risk schedule. And this includes, but not limited to, difficulty feeding or maintaining hydration when you're healthy or ill. So when you have a small child who you're having a real struggle with feeding or maintaining hydration, this could put you in a high risk. History of apnea or oxygen, if that drops during illness, so severe congestion on the regular. Seizure disorders triggered by fever or infection. This is a really good one that parents I'd really like to take note and keep in mind, because febrile seizures are an interesting topic. It could really mean do I vaccinate or do I not vaccinate? Because some of these vaccines may trigger even another seizure when we talk about the MMR. We just want to keep you in mind of some of these potential high risk reasons, because there's so many of them. So we just, covered a couple. Now that was the second schedule. So the first schedule, we told you, it's still, vaccines recommended for all. The second schedule is high risk populations, and we helped you to define high risk. Many reasons why kiddo could be high risk. And then the third, which I just find really, really cool, is shared decision making with your healthcare provider. And this is what I'm going to find most interesting when parents carry this list into their doctor's office and they're expecting their doctor to have a conversation.
Mm-hmm.
And these vaccines, the shared clinical decision-making vaccines is the largest. It's a very large list. The clinical decision-making between you and your doctor, I'm going to read these vaccines off. Rotavirus, COVID-19, influenza, which is the flu, guys, Hepatitis A, Hepatitis B, Meningococcal, 2 types. Those are clinical decision-making. So that could be a very long conversation with your doctor, but I'm sure broken up into multiple clinic visits. What I'd like to see is pediatricians coming out with PDFs, like how-tos. Here's our recommendations and here's why. I mean, Dr. Lydia, we're pumping out PDFs all the time.
That we are.
Yeah, patient education. I would love to see pediatricians start even posting this on their website. And so maybe it'd be great for all of you who are listening, call up your pediatrician or your family physician and say, hey, I've got a really great idea for you. I was just, in the shower this morning and it occurred to me how great it would be if you would come out with an information statement for each of these clinical decision-making vaccines.
Yes. Definitely don't say Dr. Mayer told you to do this. Definitely don't say that. Yeah.
Or, you know what? Dr. Lydia will come out with one and then we'll share it with all of the parents. And then y'all can take it to your doctor and say, oh my gosh, what do you think about this?
I just got this document out of nowhere. Yeah.
I created it in the shower this morning.
Yeah, I just had these ideas. I just have a few questions, Yeah.
Oh gosh. Okay. So what we're going to do is let's break this down into these diseases. Dr. Lydia, you have some really great information here. Do you want to go through every one of these?
Yeah, we'll go through it kind of high level. And it is important in our show notes. We do have I would say it looks like there's 5 key questions here that apply to all vaccines. Do you think we should just list these off? Maybe we should. Because if you do not want to get into the weeds with the individual vaccines and kind of know what each of them does and what they are, you could just come with these 5 questions to start a conversation.
Well, you know what? I like what you did, though, with rotavirus. I like that you're giving parents this information. So let's just talk about it. Let's talk about intussusception. Let's talk about where the risk is with rotavirus. Parents, hang on. This might be a longer podcast than usual. But we really do I think this would be great. Let's go through each of the diseases that are on the clinical decision-making. Dr. Lydia has put together questions that you can talk to your doctor about. So we've already made the pamphlet, Dr. Lydia. We've already made this pamphlet for you to talk to your doctor to help with this clinical decision-making and educated questions that you can ask. Because I'll tell you what, when parents would come to me who are highly educated when it comes to vaccines, who know what the disease is, how it's treated, the symptoms of it, if they can come to me and have a very informed conversation, I'm very much more willing to go by what they would like to do, as opposed to a parent simply saying, vaccines are toxic and I don't want you to put aluminum in my kid. That conversation is a little difficult for a pediatrician to want to have with you. But if you came to them and said, hey, look, my child's not in daycare. I know about the risks of intussusception with the rotavirus vaccine. Can we have a conversation about this? I, as a pediatrician, would be very much more inclined to have that conversation with a parent. So let's do it.
Okay. Well, we can dive into rotavirus, which is really a vomiting and diarrhea situation, big time. That's really rotavirus. You're going to be up to your elbows in boot kind of thing. Your kid's going to be sick from a gastrointestinal. And it really is a disease of daycare and group care primarily.
Fecal oral transmission. Kids are playing with toys. They put their hand in their diaper and then they go back to playing with the toy and the other kid picks it up and they put the toy in their mouth. That is how rotavirus is transmitted. Fecal oral.
Exactly. Should we talk about what intussusception is?
It's a telescoping of your intestines after the rotavirus vaccine. It's where your child's intestine turns in on itself, and it's kind of turns inside out is really what it is. And this is a side effect of the initial rotavirus vaccines that came out years ago, not too long ago, and they recalled them. And so they had to reintroduce new versions to market, and there still is a risk. So let's talk about benefits, risks, and shared decision focus. You want to do that, Lydia?
Sure. So the benefits of the vaccine is really to try to keep your child out of the hospital with severe disease and dehydration. So your child may still get rotavirus. They actually kind of probably will, even with the vaccine. It just will not be as severe. Fingers crossed, right? That's the point of it. The risks of the immunization is it is a live oral vaccine. So, kids can get a little bit feeling sick afterwards if you're not conscious about washing your hands after changing a diaper. Even you can get a little bit sick after this. And it's a very small but real issue with intussusception, or that telescoping of the intestine where it kind of gets stuck into itself. And that's a very severe consequence. So really the shared decision making is around how likely is my child going to end up in the hospital with dehydration and real GI stuff versus do they need this? Is my child in daycare? Are they going to play groups where they're going to be having this fecal oral transmission of these little microbes?
I like to say this. When is a 2-month-old going to have another child's feces in their mouth? That's really what it is if they're at home with mom and dad. The transmission is so highly unlikely. And so I also want to speak to this. It is a live virus vaccine. And so when you do give this vaccine, it sheds in your child's stool for up to 14 days. And so that's what Dr. Lydia was mentioning, that you as an adult caregiver, if you didn't wash your hands after you changed your child's diaper, you could in fact get symptoms of rotavirus. And you are in fact possibly, if child's in daycare, passing rotavirus on to other kids who are not vaccinated in daycare. Keep in mind, the rotavirus vaccine is not given after a year of age because it's just known that all of us have been susceptible and acquired some type of rotavirus. And by age 1, we don't vaccinate it for anymore.
Mm-hmm.
So let's talk about COVID-19.
Yeah, benefits and risks. So COVID-19 is really applicable to more so high risk. Again, children, I would say children that have either when they get respiratory infections, it gets really gnarly, it goes downhill quickly. Maybe the lungs are immature. They have inflammatory conditions of the lungs. But the benefits would be more so in this high risk population because most children experience COVID-19 as a relatively mild disease.
Yes.
So then you're kind of weighing those risks and benefits.
COVID-19 is still a very strong, it's not a buzzword, but it's just very strong in our minds after everything that happened over the last several years. And so I like that parents now just have the option of whether to do it. And the strain, whatever strain's going around, may not be the strain in the vaccine. And I'm just happy to see that it has moved down to the clinical decision-making schedule.
Yes. This might be one of those vaccines. There's some vaccines that you vaccinate for the child, and there's some vaccines that are more to prevent population spread, like hepatitis B can be one of these. So it's like if you have, say, a grandparent who has COPD, you may choose to vaccinate your child so that they're not bringing COVID-19 home and now grandma has an issue. So sometimes that's another reason why we may choose to vaccinate, because we have somebody else in the household who's immunocompromised or is a senior that we're looking out for. So COVID-19 can be one of those.
Yeah, or, a kiddo with common variable immune deficiency or any other type of immune deficiency, whether they're going through chemotherapy or radiation. And so it is beneficial to speak to your healthcare provider if you do have one of those populations in your family, because you may or may not vaccinate for some of these because you want to protect your child. You may doing this because you want to protect someone close around you.
Yes.
Okay, so let's talk about the flu vaccine. What do we talk to our doctor about this?
One thing that's actually not here that I want to mention, we had this in our parent group. If you want to know the effectiveness of the flu vaccine, the CDC does have something called FluView, and I found it to be quite an informative website where it tracks flu cases. I did find the CDC was monitoring this one quite well. And what they do is they look at the flu strains in the southern hemisphere because they go through winter at a sort of before us or after us, I guess. But they kind of look at what was going on in the southern hemisphere and the effectiveness of the vaccine that year. And then they extrapolate it to where we live in the northern hemisphere. So if you want to know how effective the flu vaccine is, you can use that as a number. You can look up how effective it was in the southern hemisphere and bring that number to your doctor. So for example, in this last flu season, it's about 50% effective at keeping people out of the hospital and from severe disease.
I love that. Dr. Lydia, I didn't know that the CDC had FluView.
There's FluView.
Thank you.
Yeah, it's got a neat little name. Yeah.
I just love you. She'll put that in the show notes. So there'll be a link where you'll be able to take a look and see what's going on. I think that's a really great tool for parents to be able to use moving forward. So thank you. Oh my gosh, I should probably do a video on social about that, Dr. Lydia.
Yeah, because somebody wrote in and they're like, oh my God, there's a super flu going on. Like, what is a super flu? And I'm like, okay, there's no super flu.
I'm getting a lot of questions about that. The super flu A.
Yes. It is a hard one on kids this year. It's the H3N2, and then there's a subclade K, it's very inflammatory for children. It is hard on their respiratory tracts.
10 to 14 days, y'all.
It's a rough 10 to 14 days.
It's a long flu.
Yeah.
Okay, so let's, the questions to discuss with your doctor.
Yeah. So really, these are questions to ponder yourself, and to discuss, but my child's under 5 or not? Is my child asthmatic or medically vulnerable? You're really concerned about lung tissue when it comes to the flu. You may have aches and pains and stuff, but it's really the lungs that we're trying to protect, because the worst consequence of the flu is, worst case scenario, is really bad pneumonia and or sepsis. That's where things have gotten gnarly. You usually have a secondary bacterial infection, and that's where things can get scary and go downhill for parents. So really, you're looking at, are my kids' lungs, are they okay when they get sick?
Are my kids' lungs healthy when I'm not sick? And are they maintaining same amount of probably oxygen? Probably is the lung tissue maintaining a state of kiddo not going downhill too quick when they do end up getting the flu or when they do get sick, for sure.
Yeah, and do they tend to get pneumonia? Yeah.
And that's another one, too, is that parents who have children who start out with a cold, who often it turns to bronchitis or pneumonia on the regular.
Yeah.
These are most especially the kiddos that you may want to look at the flu vaccine, because that is typically hospitalization for the little ones.
Yeah.
And you can't know until your kid's obviously a little bit older or more mature. But if in their first year or two of life, their colds chronically go to bronchitis or pneumonia, that's a red flag, because they shouldn't.
So a lot of the decision-making conversation is going to be just that with your doctor. I have a child who every time they get sick, they get a sore throat, they get a runny nose, but their lungs are clear. We don't end up with a cough. They clear congestion just fine. Maybe that's a different situation for the flu vaccine versus that child that always ends up with a whole bunch of phlegm in their lungs, and it takes them 8 weeks to clear a cough. And, that might be, that'll be a different conversation.
Okay. Thank you. I think, are we on to hepatitis A, or is there anything else to talk about flu?
No, I don't think so.
Awesome. Hepatitis A. I like to say that you are traveling is my favorite thought. And hepatitis A is not like hepatitis B. It is self-limiting, meaning that you clear it eventually. So it's not like hepatitis B where you have lifelong issues potentially with your liver. Hepatitis A, you clear. And so when parents ask me, hey, look, I haven't got my kid the hepatitis A vaccine, but we'd like to go to South America. And they're, age 4, 5, 6. I say, well, do you want to ruin your vacation? Potentially, if they come down with it.
Yeah.
But I'll also say this. There are many, many other diarrheal diseases that your child or you or your family may also contract that we don't have a vaccine for. So take a look and find out where you want to travel. And if there's a high endemic prevalence of hepatitis A, think about vaccinating for it. Because if you're eating out at restaurants or you're buying food from the grocery, anything that's fresh fruits and vegetables or that's been handled by other people, you want to be cognizant of when you're traveling. And you can't always, know when you're at a restaurant how the foods have been handled. I remember my best girlfriend and I, we went down to Mexico several years ago, and I ordered a beer. It was a bottle of beer, and she ordered the frozen drinks. Just looked so fantastic. There was like a beautiful umbrella with a big piece of fruit.
Yeah.
And she just loved it so much until the next morning, and she'd severe Montezuma's Revenge, and it was the ice.
Oh, no.
Yeah, it was the blended ice. And so just keep that in mind that when you go to a restaurant and you have a blended drink, that was in their water. So that's what to keep in mind with hepatitis A. But go ahead. What are the key questions to discuss with hepatitis A?
I think with hepatitis A, a lot of it does come down to the travel. It's just not that common in the US to make it an issue. There's some countries where you tend to eat more from street vendors, even like that's just a common practice. You don't really cook, you eat all your meals out. You may want to consider it then. For children, it's one of those vaccines that it's actually, hepatitis A is quite self-limiting for kids. It's more so that the kids pass it to the parents and the parents get not feeling so hot with that.
So those are the things to keep in mind when talking to your doctor is it's really travel. And that's what the CDC said. So the little bullet point that they say underneath the new schedule about hepatitis A is typically travel. So if you're traveling. All right, hepatitis B. This is a really big one, Dr. Lydia. I cannot believe that they moved this to clinical decision making. Well, high risk populations for sure. I've always believed and I've always said that if you, mama, are hepatitis B positive or you have a caregiver in the home, definitely think about vaccinating your kid for hepatitis B. And that's the stance I have always shared. It's just really nice to see that universally, not all children moving forward need to get vaccinated with hepatitis B because this is a 3-dose series, heavy on aluminum. And now it's typically a 4-dose series because they had the newborn vaccine of hepatitis B, which has just recently been removed from the schedule. But if you're using a combination vaccine in your pediatrician's office, they do 3 doses of the combination vaccine. So your child was actually getting 4 doses of hepatitis B instead of the CDC's recommended 3. So the fact that those 3 or 4 doses have been completely removed from the universal schedule, that's big news.
It is because hepatitis B is not, and I want to temper this, it's not impossible to get, but it's not easy to get. And we have had parents write in and say, I was talking to my pediatrician and they said that if a child, say they had a cut on their hand, they had hepatitis B and they touched playground equipment and my kid comes by and licks that pole, as kids will do at times, are they going to end up with hepatitis B? And it's just in casual contact, which that would be considered, hepatitis B does not spread that way.
It would be extraordinarily to the millionths low probability that your child would contract hepatitis B. But what I would like to see, and I am going to call LabCorp Norquest because I do want to know what the turnaround time is of a hepatitis B panel. Because what I'd really love to see is universal acceptance in hospitals and those providers who have mamas, because to test mom just before delivery or within days or weeks of delivery or right after delivery to be able to see, is mama hepatitis B positive? Because one of the arguments I've seen from pediatricians and other emergency doctors on social media is they're like, how do we know that mom didn't get infected with hepatitis B sometime during her pregnancy after she gets her hepatitis B titers run at the beginning of pregnancy? And I'm on board with that. Like, you can't know. Like, your partners aren't always forthcoming about what diseases they may have. And if you've had multiple partners potentially during your pregnancy, and it's not unheard of, then how do we safeguard these and how do we protect these newborns from hepatitis B if mom, in fact, is hepatitis B positive? because that is one of the discussions that some doctors are having online. So I'm going to do that. I'm going to call SnoreQuest or LabCorp, and I'm going to say, hey, what's your turnaround time for a hepatitis B panel for an adult female? And what's your stat turnaround time? So those are different. So if you ask for a stat on a lab panel, they can typically turn it around faster. So I'd like to see that. Why not? Like, keep this hepatitis B vaccine removed from the universal schedule, even according to the American Academy of Pediatrics, simply by testing. Test mom just prior or just after, because the most severe cases are those kiddos who are born hepatitis B positive who don't know it. And that's, I think, the fear of a lot of these doctors, which I agree with.
Meningococcal?
Meningococcal. I've not ever really talked too much about meningococcal. I'll definitely start doing that in the future. But Dr. Lydia, do you want to talk about this?
Yeah, sometimes we have moms coming forward. What do I do with this vaccine? Typically, it's recommended as your kid's going off to college or university and they're going to be in a dorm. And those dorms are little cesspools of germs, as these kiddos are just cleaning up after themselves sometimes for the first time, you know.
Or they're still not.
Or they're still not. So really what you're looking at here is, does the child have immune conditions? Sickle cell disease might be an example as well. Are they entering into a high density living environment such as a dorm? Because that you may feel better having your child vaccinated against meningococcal. Meningococcal was one where I had a lot of difficulty finding numbers. Sometimes when things don't happen very often, there's almost like no numbers to report almost. And meningococcal is one of those where it doesn't happen very often, but when it does happen, it's severe.
It's traumatic, actually, is what it is.
Yeah.
And so I think it's important that parents know that this is so incredibly rare. But if your child does end up with this, the kiddo goes downhill very, very fast. So just keep that in mind. I remember when I was in college, I got very, very sick, like so extraordinarily fatigued. I couldn't get out of bed. And I was a swimmer in college, and I would get out of bed in the morning and I would go to afternoon practice, and we were training like 6 hours a day. And I was always tired. So when I got so incredibly fatigued that my little sister was in college too, she came over and she literally could not get me out of the bed. I mean, it was that bad. And I ended up in the hospital. The first thing they did was a lumbar puncture. And that's specifically because, do you have meningococcal?
Right.
So in the emergency room, when you're on a college campus, that is the first thing that they are going to think about. So as long as kiddo gets to the hospital quickly, medical treatment, they all know at the emergency room doctors, they all know to always do a lumbar puncture first when there's severe chronic fatigue in a college campus setting. But that's not to say that, kiddo would wait a day or 2 or 3 thinking they'll get better. Maybe it's just the flu. And then they succumb to meningococcal. So just remember that it's just one of those that kid goes down quickly, but it's so incredibly rare.
Yes. So that really covers the changed vaccines.
Yeah. So let's see what you have here at the end. This is all in the show notes. Dr. Lydia, this was an amazing podcast.
I hope it was helpful for parents. In our show notes, we do sort of lay out the questions really plain language for you so you can have these conversations. And we have 5 core questions that you can ask about any of the vaccines, which maybe I'll just rhyme those off now so that we can just close this and, parents can feel really empowered. So basically it comes down to, how likely is my child to encounter this disease? So know your numbers with your public health department, or request maybe that your pediatrician, hopefully, may help you with this. If they did contract the disease, how severe would it be for them, for my individual child? What are the risks for them? What does this vaccine realistically prevent? Because there can be a lot of confusion. Okay, my kid's not going to get measles. They're not going to get rotavirus. Yes, they still might. It's just, it may not land them in the hospital type thing. Because that's often, vaccines are there to prevent your child from getting really sick. They don't necessarily always prevent the disease. What are the known risks? What are unknowns? And is now the right time? Or can I defer this? Can I wait for my child's immune system to mature a little bit? So those are kind of core questions that no matter what the vaccine is, those will apply.
I love that. So when you go into your doctor for your clinical consult about the vaccines that are on that third list, those are the 5 questions that you can use to start the conversation with your doctor. Doesn't mean they're going to answer them. It doesn't mean that they have the answer. But it's kind of really great that I think the more parents come in, the more questions that they're feeding doctors, I think it's great because then it helps to keep the doctors up on vaccines. And I'm looking forward to this. And so I really hope this was helpful for all of you. And Dr. Lydia, thank you so much for all of your efforts all of the time. Like I'm so impressed by you all the time. So thank you.
No, likewise. You know, you really started this whole conversation so many years ago. And since then, you've amassed a real grouping of very smart, bright parents who ask wonderful questions, and they're thinking critically. They have their thinking caps on, and they don't appreciate public health just telling them what to do, tying their hands, not giving them any options. It doesn't feel good to them.
No, so this is great. So until the next time, I have no idea what the podcast topic is, but you guys have a wonderful day. Bye now.
Bye, everyone.
I have so much more to talk about. So if you'd like to continue listening to this conversation, please join my VIP membership community. After signing up, you'll have access to my full-length episodes, my very lengthy library of parent-focused resources, including my treatment protocols, access to my parent support group, and exclusive product discounts. Join my community at drgreenmomvip.com. Thank you for listening, and I'll see you next time.